Hi, my name is Darren Zorn. My number is 817-269-7948. This is to FBI Director Kash Patel. I've got an amazing story. I think only you, the FBI, can address, investigate. I have another situation I'll put that in a separate video, but that my civil liberties, I'll get to that one later. Basically, it involves Green Oaks, Medical City Green Oaks Hospital in Dallas. In 2023, there's a short story I have to say to explain, get the context of why I went to that hospital. There's the information. And basically, my wife has two traumas. She got in a car accident 2 years ago in 2022. Didn't tell me about her how traumatized she was until a year later. And then weeks after that, she tells me about a trauma she had when she was younger. It seems like anywhere from 16 to 20. So I pieced it all together. It's been just a 2+ year ordeal where her trauma, her PTSD mechanism kicked in when she was younger for the original trauma. Okay, I've had to study this. Which made her younger trauma come to the surface after 33 years. Never heard about it. She never mentioned it until after the Lincoln trauma. We had a Lincoln classic car. About a month. So in 2023, it was in June of 2023, earlier June. I was at our apartment. We have a patio 15 feet off the sidewalk where everyone walks their dogs, first floor, in Fort Worth. A young guy walks by and he says, "Hey, do you have a beer?" I'm like, I see he was clearly a nice guy. Usually everyone is, because everyone there is, it's the community. I said, "Yeah, sure, jump over the rail, climb over the rail." So he did. We had a few beers. He was telling me that he's young, he's a 30-something IT engineer, and he manages 8 other engineers. He was telling me about how amazing it is at work when he said it's like I have Jedi powers, because when I ask someone to do something, one of my employees, they do it. And I just said, "Dude, that's not Jedi powers, that's called being nice to people." You're doing good, man, good job. And then he starts talking about anxiety and depression. And I asked, and he was telling me the 3 ways that I already just recently found out how to get out of an anxiety bubble. You look around and recognize 3 things, wiggle some body parts, your hands, your feet, deep breaths. And he was telling me this, and I said, "Dude, how do you know about anxiety getting out of, at your age?" So anyways, we were talking, and the 5th time he mentioned that he's proud of his Irish parents that never been divorced, I looked at him and I said, "Dude, you're experiencing exactly what we're talking about right now." He looked over my shoulder at a clock, I think, and then a thermostat over on my other shoulder, and looked down at the stool I was sitting on. And as all of a sudden his expression was, "Holy crap." And he looked around. He brought himself out of an anxiety bubble. Pretty cool. I said, "Good job, dude, you've got this." Okay, that happened. So then I had a medical procedure, a colonoscopy. I was up for 48 hours. My wife's trauma, she was stuck. We almost got divorced because of her trauma mechanism. Her trauma mechanism manages her for stress and whatever. Just, it's so debilitating. Anxiety or this trauma stuff is absolutely, people need to study that more. But anyways, I hadn't seen my wife in 2 months. She's got a separate apartment because we almost got divorced months before. And within 3 weeks, we got back together, signed in writing, no more divorce. Okay. Never got divorced, but she was in her apartment. I was exhausted. I was driving around after I was released from the hospital. I started making very bad decisions driving. I didn't want to hurt anyone or kill anyone to cause an accident. So I pulled over, called the ambulance, paramedics. They got me to the hospital. I'm at North Richland Hills, Medical City, North Richland Hills. Just had surgery there a year before for a gallbladder. Asked me all the questions for exhaustion, hooked me up to IVs and stuff. All of a sudden, a monitor that's been there the whole time next to me comes on, and this was a Zoom call therapist. And her job is to make sure I'm okay and I'm not going to hurt anyone, or if I feel I'm going to hurt myself, you know, policy for the hospital. She said, Darren, your wife, Blanca, is on watching this remotely. And that was 2 hours after the stupid questions, repetitious. I'm like, okay, I guess that's great. Didn't really believe her. Asked her about how my marriage and stuff. I was telling her stories, and I told her, the therapist, about the neighbor kid who pulled himself out of a trauma. And I told her about everything about our marriage, and then right now my wife's got a trauma and this and that. She goes, Darren, I'm releasing you immediately. Thank you for that story about anxiety. I, in my career, never have heard someone personally involved in bringing someone else out of a trauma and bubble. I said, that's great. She goes, I'm going to use that in the future for my patients. I said, cool. And I'm releasing you immediately. Your wife's here on the 5th floor to take you home. She loves you. And I said, cool. And so I was rushed out. Then there was 3 nurses that heard the whole Zoom call. They were so thrilled for me about our relationship. They stripped the IVs off and took the papers, said, Darren, go, you don't need these. She goes, 3 of them kind of ushered me out of the door to go through that door and go be with your wife. I said, okay. And at the time, I was needing to find my car. And because I didn't know if it was true, but it took me the next day to realize, oh my God, Blanca wasn't there to pick me up. Basically, within a minute that the therapist told me that she's releasing me, nurses had me out the door. Within a minute, she was supposed to be there. She locked up in her trauma and walked out of the building without me. That's pretty rough. So, with her trauma, I needed someone like that therapist. Her name's Jennifer. Think of it in a second. Her last name. I needed to talk to her, find her. For one thing, if she was watching remotely, I needed to find that video to show my wife, because when I finally talked to her about 2 weeks later. And I told her, baby, you were at the hospital watching the Zoom call. She didn't know she did it. She denied she did that because of her mechanism. She's not supposed to know what her mechanism does when her mechanism is managing her. I didn't know about this stuff 2.5 years ago. Never needed to know about anxiety, trauma, mechanisms. The mechanism, she doesn't know she has a mechanism. She didn't choose it. She didn't ask for it. It's God-given. It's automatic. So she denied it. So I was needing to get a hold of this therapist that knew how, because I guess most therapists don't know how to get someone out of an anxiety bubble, which my wife, at the time, I thought that's what it was. Anxiety, not trauma. Didn't piece it together then. So after many calls at that hospital, no one knew how to get a hold of this therapist, and I found out that she was remotely in Dallas at this medical city, Green Oaks. So I finally had to drive to Dallas from Fort Worth. Walked into the facility. They said, oh, well, you have to sign in like a patient. I'm like, I just need to know if I can get the therapist's name, phone number, or if she's here, if I can talk with her. She can help my wife. Probably the only therapist around that can help my wife. The thing is, which is why I'm calling the FBI. Thank you. Welcome, Director Patel. Been watching you for years. You're phenomenal. We need this rehab of FBI like crazy. Had a lot of interactions with the FBI. Trying to, anyways. Failed. Absolutely failed me. The system, the menu system, if I wanted to report a crime, a federal crime, a citizen cannot call in. You have to go online and do this and do that and do that. That needs to be fixed. The people answering the phone, he was woke. I mean, I talked to 2 people at that desk. Didn't know how to help me, didn't know who to send me to. I've been in the FBI building here downtown, the federal building. You can't get close. You can't even get past security guards to talk to an FBI agent. Jesus. Macho, ego-ridden, testosterone-laden security guards. Oh my God. And in these 2 years, I didn't ask for all this information about trauma mechanisms. It just is pushed on me. There's other stories. It just happens that people just anxiety bubbles, like a taxi driver. I had to tell him, I actually brought him out of an anxiety bubble, and another person like a week later. I'm like, what is going on here? How do I know all this stuff? I can detect people in an anxiety bubble and get them out of it. I don't know. I didn't ask for it. Anyways, I go to the hospital. I just went with the flow. Whatever you say, I'll do to help my wife. Finally filled out the paperwork, got into a little room, took my blood pressure, all this. Nurse told them what I needed to do. I needed to find this nurse, the therapist. Okay, she was a very nice young nurse. Perfect, normal. Then they transferred me to another room. And then another room, I think. And then the next room, another nurse comes in. Oh, and they started saying, well, according to your results, your blood pressure and your records, they pulled my records, we need to keep you inpatient. I'm like, what the fuck? Are you kidding me? No, I'm not. I'm here to get some information. That's not the end of it. All of a sudden, a nurse, a Nazi, classic 1950s, 60s movie of a Nazi nurse with its ugly dress and the hat and the tied up hair and a bun and a wooden board, whatever you call it, comes in and says, yes, Mr. Zorn, we're going to have to check you as an inpatient. I'm like, what the hell are you talking about? I see the video cameras there. I go, no. I said, here's my debit card. I'll pay for your time. I need to go. And then I'm looking around. I'm in a secured area where there's steel wire mesh on the windows. Needs a security card to check in and out of the doors. And so I was just agreeing with her, and she left. And then the damn main doctor came in the room and started saying stuff about my blood pressure, and you're very agitated, Mr. Zorn. I'm like, are you kidding? I'm calm as a cucumber. Unbelievable. Started saying stuff about past test results and I might be endangering myself. I'm looking at him, I'm thinking, are you okay? And I'm like, I can read this guy. He's in an anxiety bubble. And then the young nurse comes in and she's different. Oh yeah, but because she had talked to her boss and didn't want to let them down, went with the flow of, yeah, I need to be checked inpatient. I was like, oh my God, I think they're trying to keep me here. So another time, so I needed to go to the bathroom. So I walked in out of the door around. I'm like, I'm locked in this hallway. There's like 4 different rooms. I go back to the room, notice the camera again, get on my phone. I'm like, I need to do something. I dialed 911. I'm talking to them. I just happen to have the speakerphone on. That's how I usually talk. All of a sudden, the Nazi nurse comes in. She goes, who are you talking to? I said, 911. I need to get out of here, and you're not listening to me. She goes, 991 dispatch. He's calling from a, what does she call it? Not a loony bin, but a psych ward. I'm like, what the fuck? This is a psych ward? It's an old term I've never heard in a long time. I thought I was in a hospital. And the dispatch person goes, okay, ending call now. Click. I'm like, what the hell? 911's not even gonna listen to it? The hospital has, or the psych ward has that authority over 911? I started, oh my God, this is very weird. So I played calm. I said, okay, I'll go inpatient. Take me in, change my clothes, whatever, get me a bed. Is there a bed? Just played along. Yes. She goes, I'll be back. I said, well, I need to go to the bathroom. She goes, okay. So I was in there, I went to the bathroom. I'm like, I'm getting out of here. I walked out of the bathroom. The Nazi nurse is in front of me, like she's gonna stop me, or there to make sure I don't get away. And I can see the exit over there, the old security guard who couldn't protect himself. He's so old and he can't even walk. So I walked towards her, and then I just went this way and walked straight towards it. She kind of motioned like to grab me. I walked straight, and it's all I did. I said, bye. Walked out, got in my car, and when I was driving on the freeway, I'm like, oh my God, they tried to keep me in this facility. Could have drugged me, whatever. And I'm thinking, who do I call? State Patrol? Who do I call to report this? And I'm in the thing like, don't ruffle feathers, and no one would believe me anyways. So I said, forget it. When I find this therapist, she can actually, with the knowledge that she knows from the story I told, help everyone in that facility, because they're all egotistically driven, anxiety bubble, easily can be triggered to put into a bubble. That's so dangerous. So if you could, please investigate that hospital, put an undercover. I'll even help you if you need. That hospital, and God knows how many other hospitals are doing that to people. I just went in for some information. wasted my time. Unbelievable. Even the head doctor. I gave you my number. I'm just documenting this because I'm gonna send you a link to for the FBI website. Please do that. Investigate that place, because people are gonna get hurt for no reason. I mean, I just got cleared from the Zoom call therapist. She thought I was very, very okay mentally. I never even figured any of that. Okay, you have my phone number and my name. Green Oaks, Medical City, Green Oaks Hospital, Dallas. Thank you.